Hey everybody, it's Brian MacArthur from Design by Medicare. If you're watching this video, you probably saw the longer video to prepare you for the open enrollment season. And you probably caught wind that the entire insurance agent community across the country has now been excised, I hope that's the right word, from the Part D drug plan market. Not what we expected, but it is reality. So quick recap, we no longer have visibility on your drug plans. We no longer get paid on placing new drug plans, but they also took away our existing revenue on drug plans we've been setting you all up with forever. So, the revenue is one part, the visibility is the other part. So, we're limiting our guidance on Part D drug plan reviews to really our most vulnerable clients. So, if you're age 80 or older, we'll just help you through it. We can't transact it. You're gonna have to submit the application on Medicare.gov. If you're chronically ill, terminally ill, we'll take care of it. If you're living in a nursing home, that sort of thing. So if you're not in those people, we're going to ask you to just follow these instructions. Thankfully, it's actually pretty easy now on Medicare.gov. It's easier than it's ever been. So, it's not what we expected, but it is what it is. So after October 1, I'm going to direct you to go to Medicare.gov. Okay. I'm going to speak a little bit more slowly. Keep in mind when you watch a YouTube video, if you click on the gear icon, you'll get a drop down menu and then you'll see playback speed. It'll always be at normal speed. But if you click on that, you can speed this thing up or slow it down to 1.5x or 0.7x to slow it down, that sort of thing. All right. So Medicare.gov. All right, and then you're going to go down here to find health and drug plans. Okay, you can actually do this without even logging in. Okay, if you want to log in, that's fine. I'm going to show you how to do it without logging in. So type in your zip code here, hit continue. Right, I'm going to keep moving the mouse around to draw your attention. You can have three options. Choose the middle option, Medicare Drug Plan Part D. All right, we'll do that and click Find Plan. All right. Most of you do not qualify for these low-income programs, so for the most of you, you're going to click the bottom. I don't get help from any of these programs, and you'll hit continue, okay? Do you want to see drug costs when you compare plans? Yes. So that, and hit next, okay? So let's type in a couple of medications here. We'll go looking for atorvastatin. You can just type in a couple letters and it'll probably pop right up. Okay. We'll hit add drug, 40 milligrams. Even if you refill your medications quarterly or every 90 days, just put it in monthly. It just keeps the system from getting skewed. So one a day is 30 a month. Okay. So just 30 a month. Hit add to my drug list. Let's add another medication. Let's go metoprolol. There it is. Metoprolol. We'll do succinate. All right. Now, when you do this, a lot of times the drop-down menu has a bunch of different options. Just take a look at your pill bottle, make sure you're choosing the right dosage, and tablets versus capsules matter. So just, give it a good look. 25 milligrams, 90 every month. That would be 3 a day. Okay. So we'll just do that and put add to my drug list. Let's click done adding drugs. Okay. Here you can choose a pharmacy. You could choose, it'll honestly bring up the pharmacies close to your home. So you could do mail order, Vons, Rite Aid, whatever. Let's just do Vons. To add pharmacy, you could compare pricing at 5 other pharmacies if you'd like. And down here in the bottom right corner, continue to view plans. Okay, here we go. Okay, so this is going to show you all the plans available in your county. You'll see here there's 16 drug plans. There's only 16 drug plans in the county. What's most important, the way the defaults work is they just keep it easy. Lowest drug and premium cost is what we want to see. Okay. So I don't want you to do this exercise until October 1, because October 1, you're going to be able to see the 2026 drug plans. Okay. So don't do this before October 1. You can goof around with it, but you're not going to be able to do anything till then. You can see the drug plans October 1 for 2026. You can enroll in a drug plan for 2026 after October 15. Okay, so maybe goof around with this after October 1. Once you realize what you need to do, then you just do this again October 15th and you'll hit enroll. So look, a lot of you are already on this drug plan, but WellCare Value Script, it's got a low monthly premium. That's great. Okay. I care about the monthly premium. What I really care about is the monthly premium plus the copays on the medication that you're on. That's the real dollars out of your pocket. Thankfully, the system's going to automatically put that one all the way up top. So, we've talked about this before. Monthly premiums can be high, low. That may or may not matter. What really matters is this total drug and premium costs. All right. Now, when I'm running this, it says for the rest of 2025. Once you do this October 1 or later, it'll say for 2026. Okay. So whatever one is up top is honestly what I would do. All right. You're going to click enroll. Most of the plans are going to have a $590 annual deductible. They have zero deductible plans. It's rarely worth it to pay the much higher monthly premium to have zero deductibles. So just stomach the $590 deductible. A lot of plans actually waive the deductible on cheaper meds. So just whatever's at the top is what you should do. Okay. So you're going to hit enroll. Okay. Then you'll hit join plan. Again, I'm doing this to get this out to you before open enrollment. So the confirm your election period. Mine doesn't say it now, but pretty much at the top, yours is going to say, are you doing this during the annual election period, AEP, between October 15th and December 7th? That's what the enrollment period you're using. Okay. So we don't have that on this screen, but not a big deal. Just know that that's what you're doing. Okay. In the interest of time, or just to show you the rest of the screens, I'm just going to click another reason here. Okay. So you're going to choose your election period. Or what it might even do after October 1 is not even ask you to choose a reason, because it might assume that you're doing this during the annual election period between October 15 and December 7th. Okay, but I'm going to choose an election period here so that we can advance, so I can show you this mouse click by mouse click. All right, I'm just going to put in a dummy Medicare number here. I'm going to click down here. I've read and understand the contents of this page. Next. Okay. And we'll just put in Gordon Gecko 1960. Whoops. Put in mail. Put in a phone number. These are all dummy phone numbers. 8675309. All right. There we go. Hit next. All right. 1313 Mockingbird Lane, San Diego, California. It's already got our zip code in there. If your mailing address is different, put it in. Most of you it's not. Some of it is. We'll hit next. Do you have other drug coverage? Most of you are going to click no. Do you work? Just put no. Does your spouse work? Just put no. Do you want materials by email? Up to you. What language do you like? English, and you could leave this Braille thing blank. Okay, so pretty intuitive. When in doubt, just hit no on these questions and that sort of thing. We're going to hit next. Okay, and now they're just going to ask you, do you want us to send you a bill? Okay, if you're not drawing Social Security, have them send you a bill. You could always set it up to be deducted by EFT later. If you are drawing from Social Security, choose the top option, because they'll just deduct the monthly premium out of your Social Security check, and you can't miss a monthly premium that way. Two options, Social Security and Railroad Retirement. The 99.9% of you are going to choose Social Security, and we'll hit next. Read and sign below. You'll agree to these statements, and then you'll just click, I am the person joining the plan. Okay, pretty self-explanatory. Hit next. This is a review before we submit. Normally, I would not want to clog up Medicare's resources, and I would just stop here. But since it's a dummy client anyway, we'll just make them do a little bit of work and realize that it's not a real application. All right, so you'll hit this checkbox here and submit. And there you go. You have now signed up for a new Part D drug plan if the one that you're already on was not the best for 2026. A lot of you are on WellCare Value Script. There's a good chance that that's going to show up at the top. No harm in printing this page just to have a confirmation. This is confirmation you submitted the application, not confirmation that it has been approved. So look out for correspondence from WellCare, maybe Medicare.gov, probably WellCare or Cigna, or whoever you enroll with. Right. And just hold on to that. Maybe take note of this information here just in case you have to call them. That is how you review your Part D drug plan and submit a new application if necessary on Medicare.gov. If that's all we need to deal with, then we probably don't need an annual review. If you also want to look at your Medicare supplement pricing, book an annual review. We're still going to ask you to do the review on your drug plan on your own. If you come up with any big out of the ordinary things, we're happy to put eyeballs on it. But for the reasons I brought up, we just need you to do this, and then during the annual review, happy to talk to you about your Medicare supplement pricing, long-term care, short-term care. If long-term care needs would probably involve your financial advisor. Short-term care is just less important to do so. And that's it. We appreciate you, and I hope that this helps. And it's as easy as I hope you find it as easy as we think it is. All right.